Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and I'm going to talk to you about a very serious condition called peripheral neuropathy today. Many people don't understand what that is and how it's diagnosed, and so I'm going to kind of go over the nuts and bolts of it with you. Way back in 2018, I went to a convention, and it was a convention that was full. The room was about 900 people deep, and there was about half of the people in the audience were chiropractors, and the other half were along the lines of orthopedists and orthopedic surgeons and family practitioner MDs. And one of the MD speakers actually got up to the front, and when he was giving his talk, he said, "Look across the room and I see a bunch of chiropractors, and I tell you what, I'm jealous of what it is you guys are going to be able to do in the upcoming years in treating peripheral neuropathy, because we as the medical profession don't have a clue how to treat it. We don't know. We always just prescribe a medication. Usually it's gabapentin, and it doesn't fix any problems. It just covers them up. And so if someone can learn how to treat neuropathy well, then it's going to be huge." And then he went on to say the reason why he thought it was going to be huge was because one of the side effects of statin medication is actually demyelination of the nerve sheaths. So that's a big scientific word, but what it does is it exposes some nerves because of the cholesterol that's surrounding those nerves. It kind of breaks down and gets stripped over time. And then you got nerve endings that are just exposed. So if you're taking statin drugs in high dose or for a long period of time, then you actually could be leading to the symptoms of peripheral neuropathy. So his speech was, learn how to treat it well, and we need to quit prescribing so many statin drugs. Well, fast forward all these years later, 5-6 years later now, there's been no decrease in the recommendation of statin medication for high cholesterol. So the peripheral neuropathy patients are coming in on a regular basis. We're seeing 2 to 3 on average per day. So I got board certified. The clinic here is board certified in peripheral neuropathy from the American Academy of Physical Medicine. And in that certification back in 2018, what we learned was there are 6 or 7 major causes of peripheral neuropathy, which is numbness, burning, or tingling, or some people just call it nerve pain in the extremities. Like it usually starts in the feet and it works its way up and radiates into your calves and up into all the way to your knees. Other people, it starts in their hands and it starts to work their way up the forearms. Some people get it in all 4 extremities, but it's most common in the feet is what we see in our office. So what are the causes of peripheral neuropathy? Well, one is statin medication. Another one is, maybe the most common cause of neuropathy, period, is diabetes. And we see when a person is a type 2 diabetic and it's kind of in the undiagnosed stage, or it's early on, or it's out of control and they're not taking anything to decrease their blood sugar, then it causes peripheral neuropathy symptoms. So diabetic neuropathy is a big one. Other causes could include things like a compression on your spine. If you had an old injury that maybe pinched a nerve at one point and then the pressure was released off that nerve, it still did some damage, and the other end of that nerve is going to start to deteriorate over time. Another big one is aspartame, like people that are Diet Coke addicts. The sweetener in Diet Coke is aspartame. It's found in lots and lots of things. It's in gums, it's in all kinds of drinks. And it is one of the causes of peripheral neuropathy symptoms, which is that demyelination. So to explain what demyelination is, actually, if you had, say, an electrical cable, I'll just use this as an example. So this is my phone charger. This is low voltage, but either way, the outer portion of this, the plastic coating, and then inside the plastic coating, you've got some insulation, and then you eventually get all the way to the thin wire, the copper wire. Well, if you broke this outer part down, or you cut it, or you scraped it, or you damaged it over time, if you kinked it and pinched it, eventually it would crack. And if this were a voltage wire, high voltage wire, then if you touched that where it would shock you. Well, our nerves in our body have the same exact coating around it. It's called a myelin sheath. That myelin sheath is just like the plastic coating on this thing. So if you do damage to the myelin sheath, over time, the nerves begin to be exposed. And just like you wouldn't touch this, your body's touching those nerves, and it's causing that electrical shock, or it's causing numbness, or it's causing burning, or it's causing nerve pain in some way. So that is when you break it down, that's the cause of peripheral neuropathy, and it happens in the hands and feet. It's more common in the elderly. It's more common in the diabetic. The answer to it, like I said earlier, from all of Western medicine, is to prescribe a drug called gabapentin. And I highly recommend that you never even start on gabapentin, because for one, it's hard to get off of once you are on it. And for two, it may decrease your symptoms temporarily while you're on the medication, but when you get off, they're going to come back because it's not really fixing anything. In fact, gabapentin was originally FDA approved as an anticonvulsant medication. So it was given for seizures. But I guess what they determined was that it would also kind of calm the nerves down a little bit. So again, when it comes to those types of medications, you're kind of tricking your brain into saying you don't have a problem, when in reality, you still do have a problem. You're just not perceiving it. So it's kind of calming it down while the damage still continues to happen. So there are alternative treatments that are available. We do combined electrochemical therapy. We do shockwave therapy. We do some cognitive rehab for balance training and proprioception training. There's a vast amount of things we can do. Some people get PRP, which really generates that myelin sheath around the nerves. We do it directly into the feet, into the ankles, where the problem is. So if you need any more information about peripheral neuropathy, feel free to check out our website, trinityintegratedmedical.com. There's some stuff on there about it. Or just reach out and comment below, and we'll be happy to jump in a conversation with you and explain what it is we do and how we do it. Located right here locally in Carrollton, Texas, just outside of Dallas. So if you have any issues related to peripheral neuropathy, go to someone that you can trust, that's board certified, that understands the causes, that understands all the various treatments, the pros and cons of each treatment, so you can get a really good outlook and prognosis for working on your peripheral neuropathy symptoms. So Dr. Tim here, TrinityIntegratedMedical.com, signing off. Take care. Have a good day.